Hola, hola, familia. We are so excited to have with us today Cynthia Cifuentes. She is the VP of Marketing Communications, Community Engagement for the Mid-Atlantic region for Kaiser. Thank you so much for joining us, Cynthia. You guys at Kaiser are doing great things for our community. So we want to just share this with our familia at Captiva.
Wonderful. Well, I'm happy to be here. I'm thrilled to talk about different trends and topics today. So thank you for having me.
Awesome. So I know that you moved from California to DC. What is it, 4 years ago?
Yeah, 4 years ago.
Four
Yep.
years ago, and for this big role.
Yeah.
And just share with us like how you ended up from California to on the East Coast on this horrible winter weather, by the way.
Yeah, no, absolutely. I mean, first of all, I love being in the DMV. It has such a vibrancy to it. It has so much history, but I obviously hail from the West Coast originally by way of Las Vegas. I landed in Los Angeles, where I've been for the last 20 some odd years. And I've been with Kaiser Permanente 14 years now. And I do a lot of work in the marketing communication space, but also community engagement, which is really kind of my passion and many levels, both from a personal experience being Latina, being a fellow Latina and raised with an immigrant family, and just knowing that your health is really tied to your wealth. But I started in Kaiser Permanente and I worked my way up, and they said, we need someone who has a lot of boots on the ground experience. I worked in a service, what we call a service area. So I was the closest to the member and the communities we serve. And they said, we think you can lead up the Mid-Atlantic region. Are you interested? And I happened to have my husband who had family in New York City. And I said, I've never lived on the East Coast, but why not? And, lo and behold, here we are 4 years later, and I love it.
Wow.
Yeah.
What has been your first impression of, well, I guess, what was your first impression of DC when you moved?
So I moved during the pandemic. So I moved during the Omicron pandemic, which was the second wave, as you all can recall. And so things were really, really shut down. And in the West Coast, there was that we were kind of coming out of the regulations, and we were less. I mean, we were kind of coming out in the situation where you could start going to restaurants and so forth. And so with the states of Maryland, particularly in DC, they were much more stringent in terms of the regulations and still abiding by some of the, social distancing and so forth. So at the very, very first, when I got here, it was the dead of winter. I found it very lonely and very isolating because we were still virtual. Things were shut down. Restaurants weren't open, and there was a vibrancy that I didn't get to experience until a year later. So it was tough. It was a tough transition, but I will say my experience about just people in the DMV and just in the East Coast in general is that I go by this saying, don't talk about it, be about it. And so there is just an intentionality of saying what you mean and meaning what you say. Some people will say, oh, it's a little bit direct, it's a little bit, but it's not that. It's just a genuine authenticity. If someone says that they're going to call you, they're going to call you. If they're going to show up, they're going to show up promptly. And I appreciate that because, you know where you stand, and there's just a really intentional way about being that I appreciate. I learned how to adapt to. And then one thing I will say is that people here are very much about making an impact. This is a much older part of the country, so it has a rich history, but it also has a dark history. And so being closer to all the systemic issues and barriers that have happened and predicated since our country has been founded is very much strong here. And so you see that oftentimes in the way people want to make the world a better place, the way they want to drive for impact, the way they sit on boards of nonprofits. And so you hear that and you see that in the culture of the people here.
Got it.
Mhm.
Yes. I mean, I 100% agree. I mean, I've been in this area for over 20 years, but also as a Latina, and I know you're also
Yeah,
another fellow Latina from
sure.
your parents are Ecuadorian, right? Ecuador. Um, like here, people are very much about making an impact, and I think that to me was what connected with me because I am also about making a data, and I also like people to be very direct with me as well. It's like, what you say is what you're gonna do. It's not you're no, there's no bluff about it. Coming from the Caribbean, people are like, "Ay, sí, pa mañana."
Yeah.
Ah.
Sí, eso es la verdad. También en Los Ángeles, it's like, everything's predicated on the freeways. Like, oh, I see you. Let's do lunch. And if you live on the west side, I won't see you again.
Exactly, exactly.
Yeah.
So how has this role in Kaiser really shaped your perspective on healthcare marketing, for example?
Yeah. So if I can just sum it up in one word, I think, what you learn as a publicist and just moving up in journalism and just through the power of communications is storytelling. Right? We have one job to really tell a magnificent story. And how do you tell that story in the power of me? The power, like there's actually a construct that says the power of self, the power of we, and the power of now. And 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 I think as I've moved up in the organization, what I've learned in healthcare is that in order to build trust and meaningful relationships, particularly when you're dealing with in the most vulnerable spaces and places where people are interacting, because your health is so just fundamental to how your life and your livelihood and your health is tied to your wealth, is that to be a powerful storyteller in the spirit of marketing is so incredibly important. And I've learned that through obviously coming up the ranks through communications, but how do you pull some of those threads in the brand and bringing life to the brand, and through the messaging and all of that things, and even some of the photos and the imaging, the colors, the richness, and even down to your channel strategy. All of that is really what story are you trying to tell? What is the beginning? What is the middle? And what is the end? And then at the end of the day, what do you want people to know, think, and feel? And then what do you want them to do? And so I think that's really, very, very much important in healthcare, particularly during a time where we're seeing such a lot of change. People have a lot of choice in terms of who they choose to be their healthcare provider, who they choose to be their insurance, and who they choose to be both. And so you want to make sure that you tell a really good story so they can live their best life and have the highest outcome.
Yeah, I agree with that. I mean, I've been working in comms in healthcare for a
Yeah,
very long time, and
yeah,
I think that the biggest challenge that healthcare has is on humanizing healthcare,
yeah,
which should really be it's all about the human connection, right? But
it really is.
it at the same time it feels so transactional.
It
um,
does.
because even like in Colombia, I don't know how it is in Ecuador, but in Colombia, we go to our doctor and our doctor knows about our abuelitos,
Yes.
our parents. They sit with you for an hour. So it's really not just about like making the transaction and getting you out of the way
Mhm.
to get
Yeah.
another patient to come in, but it's really about getting to know you and that connection. Uh,
Yes. Yes.
how do you even um, I mean, obviously in the US it's very different, right? Because all doctors have, I don't know if it's called like a quota or like an amount of people that they need to see in order,
Yeah.
obviously it's all about the business part of it.
Yeah.
How do you strike that balance in Kaiser? Because I really love like that one-stop shop approach. I've been a Kaiser member myself, but having like that one-stop approach to healthcare and making it so convenient for people to just do everything you need to do in one place. I
Hmm.
think it's part of that. It's part
It's
about
part of it.
thinking and keeping in mind that, our time is valuable, that not everybody can take a bus and drive and
Yeah.
commute an hour to the doctor and back and then to the other doctor and then go to their jobs, right? So they're
Mhm.
the social determinants of health. So how do you guys like strike
Yeah.
that balance?
Yeah. Thank you for asking that. I think one of the things that has been just tremendously unique to our care model at Kaiser Permanente is that we're an integrated care delivery system. So what does that mean? So it means that everything is interconnected by the electronic medical record. And so when a physician goes in and contacts you and knows you, there's your whole history up front. And usually they have all of that because right now in our country, the way we operate in the US right now is we have a fragmented system. So you see a physician, he writes you up, you need to get blood work done. Then you have to go to like a Quest Diagnostics and go somewhere else to get some blood work done. Let's just say that primary physician sees something in your blood work and now you need to see a specialist. And then the burden is on you to figure out across the DMV what specialist I need to be. The difference with Kaiser Permanente in our care model is we do that all for you. hi, I'm your primary care physician. You need to do something. There's something wrong with your, I'm just playing here. There's something wrong. We need to get you some blood work. You're going to go up there. Then we have a physician specialist that is going to see you up here on the first floor. And it's all integrated, and that there's warm handoffs between the care teams. So you have that level of comprehension that's less siloed and very integrated in those ways that make that experience very seamless. The doctor, and the specialist is going to know before you walk in what's your medical history, what's going on with you, because there's this transition period. So, or I should say, this transition handoff. So that level of comprehension and integration um, doesn't always exist in other places. I think the country is being challenged and pushed to do more value-based care and more integration. So you see more of this happening, but we are the pioneers. We've been doing it for 80 plus years, and that integration really gives you that personalized patient family care experience. It's not only about you, it's about your family. Do you need caregiver support? What's your food and diet? What's your culture? What are the different things? And so knowing that holistic, having that live in one place, which is your electronic medical record, what would you call your EMR, is incredibly important. And that gives Kaiser Permanente an advantage to make sure that we give you the right care in the right place at the right time. And so it's a very unique care model. I had to learn it myself, as I transitioned. But I tell you, once you have it, it's very hard to leave it because it's so simple. Like you said, it's a one-stop shop. You have a care team. I mean, everything from a care team where if you needed to be, observed for mental health, you needed to go to have surgery, you can get it all done within 24 hours. So it simplifies the healthcare experience in our country.
100%. And I love how innovative your app is, in which you can just send a message to
Yeah.
your doctor and be
Yeah.
like, "Hey, I'm going through this," or explain to me this test. I'm not getting it. It's just so easy, and I love what you said about like the warm handoffs. Like that
Yeah.
is so true. I
Yeah.
definitely experienced it, and I'm in a different healthcare insurance right now, and it's been really hard to make that transition. Even like I haven't even been able to schedule my mammogram because I need to go somewhere else.
But I think the difference in distinguish because people don't really always understand Kaiser Permanente in our care model, particularly in the DMV. In California, we're much bigger there, but it eliminates the burden on you as a consumer and puts it on us as your provider. So we're not only your provider, we're also your partner. So we would issue your appointment to your mammogram. We would issue, let's just say, you need to see an oncologist. We would do all that for you because it's all within one integrated system. And so those are the things that I think for any consumer is daunting. I mean, it's complicated. You need to figure out where you're going to go, what diagnostic center you're going to visit, and then from there, let's just say you need to go see someone, then you got to figure out an oncologist. It eliminates all of that hassle. So it's hassle free and it's easy and convenient and simple.
And I think that also connects a lot with marketing, right? Because marketing also is integrated with that customer service,
Yeah.
right?
Yeah.
Like sometimes people don't think of it as
Yeah.
integrated approach.
Yeah.
Once you have someone in the door, that customer service is it's
Hands
key
down.
to keeping them as a loyal client or patient.
Yeah. Yeah.
And I'm curious to know what challenges have you guys encounter,
Yeah.
especially in this area, in connecting or even trying
Yeah.
to recruit new patients?
Acquisition is obviously more costly than retention. And so one of the things from a marketing perspective, when we look to acquiring, a lot of the work that we do in marketing is relying on brand equity and understanding the brand and so forth. I will say and I can share from just firsthand experience coming from California where we have very high penetration, high brand equity. We're an institution. We have brick and mortars everywhere. There was a huge learning curve that I had to understand here because oftentimes when you have that higher level of brand equity, you operate on an assumption that people know who you are. And so the challenge that we face as Kaiser Permanente, particularly being on the East Coast, where we are a smaller player currently, we're going to be a bigger player, but we are a smaller player, is who is Kaiser Permanente and what are we engineered to do? And being able to articulate that unique care model in a place where it's heavily saturated with healthcare competition, the competitive environment is extremely fierce. Um, we have a smaller footprint just in terms of the level of integration and comprehension that we have with brick and mortars, right? So with our actual clinics and facilities. And people don't have the same baseline understanding of what Kaiser Permanente is engineered to do on the same way that they do, let's just say in California, where we're tied to the shipyard since the 1940s and post World War II. So you have a lot of legacy that helps support you and lift your brand up. And so I would say one of the challenges that we have is understanding, really understanding what products we offer, what makes Kaiser Permanente different, what is our brand differentiation here in this market, why should you choose Kaiser Permanente, and really underscoring that you have choice. I think that is been the big challenges with Kaiser Permanente and healthcare, and just healthcare in general. Is people want to feel like they have choice. They want to feel like they can pick up and they can move and they can if they don't like their doctor they can move around. And you have those exact same mechanisms with Kaiser Permanente as you would in another, insurance or a provider. If you don't want to leave, you just would choose within our system. And so I think those are some of the challenges that we have. We just have a lot of work in terms of building that brand equity and just building that understanding in our consumer base so that we can so that people will consider us and increase willingness to consider.
So even talking about like building trust, right, with some of the with communities, especially even speaking about underserved communities. I've worked in PR for a very long time in healthcare, and I know that one of our biggest challenges is really establishing that trust as a healthcare entity. Even the government goes through it. It's across because culturally and I'll speak even for Latinos, we hate doctors. We're taught that
Yeah.
doctors are going to over medicate you and that are going to basically kill you.
Yeah.
So we rather go with our abuelita, remedios de la abuelita, rather than going to the doctors for prevention. And the other way that we think it's like, if something doesn't hurt, no vamos a tracutear por ahí because something is
Eso es la verdad. We often wait till we're really
sure.
sick.
Yes.
Yeah.
So what are you guys doing to for that community engagement piece on establishing trust in the community and different partnerships?
Yeah. So we have a couple key examples that we do, and I completely relate. I actually had a life event that happened because my mom just kept saying, "Oh, she's gonna be okay. She's gonna be okay," and it ended up resulting in some care that went unforeseen, and it actually resulted in a brain surgery. So those things are incredibly deep and rooted in our culture. And so what we try to do is we try to meet we try to meet our communities where they are. So a perfect example would be faith-based outreach. Oftentimes, those faith-based communities, those local churches, are places where there is a lot of trust engendered. There's a lot of people there that they almost look to their pastors to seek advice more so than their clinical providers. And so what we've done is we've have a faith-based outreach program that we work with a lot of the Black mega churches, and we sync up with the pastors, and we come and we work with them and we talk to them about really having some meaningful conversations around end of life. Like, what are you going to do if your grandfather is dying and passing away? Are you going to have a DNR? Are you going to provide caregiver support? And having those tough conversations now so that you have a better plan for when those types of things occur. And so we use the churches as a conduit to be able to have those conversations with the pastor so that we can have those. And so we can provide the clinical expertise, but we also have someone that's validating and saying, this is important. And this is why it's important to our communities and communities we serve. Another example is we had it was a Good Health, Great Hair program. And we partner with a lot of the barbershops, the peluquerias. Oftentimes you spend more time getting your hair done. I remember my mom would go to the peluqueria and she'd be there 6 hours and she knew her hairdresser. She knew my tia would go, my prima. And so like it becomes a place of trust. It becomes a place of friendship. And so what we did is we partnered with a couple of the barbershops and we provided them and we trained them on the importance of vaccinations during COVID. And through it, we were able to vaccinate 60,000 Marylanders because there was a lot of, particularly within the Latino community and the Black community, there was a lot of hesitation on getting the vaccine because just a lot of understanding. Is it work? Is it going to make me more sick? Also, just historically, we all know there's some dark history in terms of how medications were used with Black and brown populations, and they weren't always used in a way to help us. And so we educated them. We walked through the owners of the barbershops. We parked our mobile health van there, and we did a lot of just basically stimulation, education to help people feel comfortable in the communities that they work and in the communities that they sit in and live, work, and play. And we were able to just help them feel reassured and more comfortable about getting a vaccine. And so those were just some of the key examples. We do a lot of work in the community, but those are some key examples of how we really build trust and engender trust. And I'll use just one last thing, that I learned from one of my team members. One of the things that we're really vigilant about is building with the community, not at the community. And I think that's the biggest misnomer that happens oftentimes with corporate organizations such as Kaiser Permanente is you as a corporation think, you know what, and you look at data and you say, you know what, we've had the highest dropout rates, we have the highest, you look at a community or a zip code, and then you start solutioning without involving the community. You start solutioning and figuring out, okay, well, we think they need X, when really the community might think they need Y. And so it's going to be important, and it is important for a lot of corporations such as Kaiser Permanente to build with the community to engender trust, to come up with co-designed solutions with the community so that when the corporation walks away, because eventually the corporation is going to have to walk away and move on to another community, that is sustainable. And so those are some of the key points in terms of how you not only engender trust by building with the community, but how you co-design those solutions together.
Oh my goodness. I love what you said about building with the community. That is so true. Sometimes we do think about different solutions and we think, oh my God, this solution is so creative. But at the same time, we're not really incorporating them in the process. And
Absolutely.
that there's a different solution for that. So,
Yeah.
but even so, we're in the era of AI. Um, and I think that the digital gap still exists among underserved communities. And I know that Kaiser is very much about being like you're known for being innovative. I think that what you were just saying about people not really understanding you about that integrated approach, it is innovative. It's very innovative for health insurances. Uh, so how do you guys even navigate that digital gap with some of the underserved communities or like with the aging population that may not even be aware of how to, how to use an app or download an app? What do you guys do there?
Yeah, we have a couple healthcare literacy programs. We often partner and we rely on our community-based organizations, and we do healthcare literacy and digital literacy. So there's two elements that kind of go into it. So there's just understanding what it means when we adjudicate your claim. What does that mean? I speak English and I don't even know what that means, right? It's basically we're processing your claim.
Okay.
So how do we just simplify the healthcare landscape writ large for people that don't necessarily navigate it as much and or don't have as equitable access to it? So having a baseline understanding is just of understanding what it is and how to utilize it is number one. And so we do work with community-based organizations that do some trainings. We do some technical assistance and trainings to talk about when you have healthcare, what does preventative care look like and routine care? You should probably get to see your doctor, and that an insurance would cover that, and just kind of walking through those semantics. And then the second part is what are the channels? What are the channels that you can access care, which include virtual care? How do you do it? And what is the app? What do you do to enroll? That you have to have a password. Do you have a mobile? What kind of mobile? Or do you do it on your desktop? And so we work very, very closely with community, again, building with the community and looking at different segments. And we do a lot of this work in Northern Virginia, where we have a huge prevalence of a multicultural population, everything from Latino, El Salvadorian Ecuadorian to Korean to Afghani,
Yeah.
a lot of multicultural, diverse, rich, in Northern Virginia, Fairfax County, and we work with community-based organizations to onboard them. It's almost like an onboarding. So like you're newly hired for a job, well, you're newly hired at, you're newly came to
Love that.
KC. Let's sit you down, let's onboard you and walk you through healthcare 101. And then in addition to like how you access healthcare 101 using some of the digital properties that we have. And so we've done a couple pilots in that area, and we've had a lot of great results. What we often find, and I think there's a myth that I want to bust. Um, Oftentimes people associate, immigrant cultures as non-compliant. And when I say non-compliant, I say that, we use the ED as the front door. We intentionally, wait till we're very, very sick and stuff like that, which I do think those elements can be true. Absolutely. But when I say non-compliant is once we show them how to access care, they are more compliant than our commercial line of business. They are more obedient in terms of getting their preventative treatments, getting their vaccines on time, getting their flu shots. I mean, my mom used to be like, oh my God, tenemos que tomar la vacuna, tienes que tomar la, you have to get your vacuna. I was like, oh my gosh, mom, okay. Once she understood and got it, she was like on it. She was
Yeah.
like, no, tenemos. And I was like, wow. So I do think there is um, a gap in understanding with immigrant cultures that we just don't go to the doctor. I don't think it's we know how. And so once you give us the tools in terms of how, then we're compliant. We show up. We go to our routine visits and stuff. And I think that's the part. The healthcare literacy part isn't talked about enough and isn't understood enough of what it means. And oftentimes, in Latino America, sometimes healthcare is a privilege, not a right.
Oh,
Tú
100%.
sabes,
Yeah.
es toda plata, it's everything money. And if you
Yeah.
are if you're from a higher strato, a higher stratification, then you have access to a doctor. If you're from a poor fisherman town, you don't get a doctor. And
Yeah.
so everything is associated with socioeconomics in terms of your access and privilege. Where here it's a little bit more where, yes, we do have those circumstances, but if you have insurance, you can have access to, a doctor. And so those are the things that I think are hard sometimes to understand, particularly with cultures that are coming from different countries, where it isn't on a paid system that way.
Yeah, yeah. I mean, the health literacy component is a very important factor, um, because we don't know what we don't know. And what we hear from la vecina is probably not true.
Not true. It's so true.
Or
Yeah.
then that education piece. I mean, across different, financial, health, education, we all need to really educate ourselves how things work here in order to take advantage of the benefits that we have. So,
Yeah.
so moving on to like, I want to understand as a VP of marketing and the rest of your title for this area, where do you go to like stay on top of trends? Like, are you listening to podcasts? Are you reading websites? Like, tell us.
Yeah. So I read a lot of, just because, healthcare in general is just really based on the human condition, right? A lot of it, yes, there's a lot in terms of patient care, and there's like some clinical aspects that I don't want to discredit it at all, but a lot of it is on behavior change. There's a
Mhm.
lot that can happen in terms of changing someone's life and changing the impact and the outcome of someone's life by strictly behavior change. So I read a lot on just different elements of, of behavior change, like habit forms. Like there's a book called Oh my God, it's How to Form Habits. I don't know the name of the book, but that's one
Is
that
that
talks
the
about
Atomic Habits?
the atomic,
Yeah,
yeah, the atomic
James
habits.
Clear.
That one.
Yeah, Atomic
Yeah,
Habits.
that talks
I,
about how you institute and create culture change through building habits, not only within yourself but within others. Obviously, I'm a leader and I lead a division of people. So I read. There's a book I'm reading actually by it's called CEO Excellence. It's a book that is, oh my gosh, I'm blanking on the consulting firm, but what they did is they interviewed the top 200 most, the highest performing CEOs that have turned around their companies, like Microsoft, Meta, and what are some of the key things that they did to be able to effectuate change across very, very complex issues within their company that turn their company around. So it's called CEO Excellence. And
I'm
then the
looking
other
to.
one, yeah, CEO Excellence. It's really, really good. And you don't have to be a CEO to read it. It's very fundamental on, how you might want to lead your family, how you might want to lead, your department. So it's applicable across all elements, and you don't necessarily have to be CEO. So I like that because it's relatable. And then the third one is Brene Brown. Um, Dare to Lead. She's taught me a lot about the power of vulnerability. And when you're dealing with complex issues such as patient care, such as healthcare, such as marketing, that sometimes being vulnerable and just owning your truth and that is the deepest part of human connection, and that is the most meaningful part to be able to effectuate and influence and inspire change. And if you can just sit in it and be very transparent when you're being vulnerable, when you're having some conversations, and sometimes courageous conversations. I just had a really difficult conversation with my chief marketing officer of the whole enterprise about some things that we needed to change around and rethink and think differently. And being able to let your guard down and just lean into the conversation to come with a solution and admit that you're being vulnerable in this space, it changes the narrative and it changes the way people receive information. And I think it changes the outcome of any conversation and any big change that you're trying to implement.
Yeah.
So,
I
yeah,
am a huge Brene Brown
great.
fan. I listen to all the podcasts that she comes up with, and
Yeah,
love the way she interviews. She does like that rapid fire at the end on their
yeah,
podcast. And I
yeah,
absolutely love her,
yeah,
and her books. Um,
yeah.
so because I'm a foodie, um, I'm always trying to get the scoop on what restaurants are people going to. So what DMV, because I know you live in Maryland, what DMV restaurant are you craving?
Well, so I will say full transparency. I have not got out a lot. It's been really,
There's no
just
shaming. There's no shaming.
yes, just between work. But I will say, I went to this fabulous, fabulous restaurant in DC, and I feel like I'm there every time I have someone in town from Los Angeles. I'm like, you know what, we got to go to this place, and it's called Shoto.
Oh
And
yes.
it's such a vibe. I feel like it's Miami meets DC. LA, Las Vegas meets DC. We got a DJ uns uns over here. I'm eating some sushi. I got a little bit of seared steak. Like, and then it's got this beautiful back. I mean, it's just such an experience. And I think it had just opened like 2, 3 years ago. And they were like, oh, there's Shoto. So yeah, the general manager knows me. And he's like, I was like, this place is the bomb. And so I do love Shoto. It's been an extraordinary experience. And every time I go, when I save up for it, I have,
I know. You
yeah,
to say Bob.
yeah. Yeah, one time we went with some neighbors and he kept ordering bottles and I was like, wait a minute, hold on, like I got it's like a little bit. So but it's fun, it's lively, it's got a vibe, it's got great energy, and it's great. I love Shoto.
I also think that if you like Shoto, you might like Balos. I don't know if you've been to Balos.
Ooh,
It's a
no.
Greek
I'll have to
restaurant
write
in
that down.
Yukon Circle, and they
Okay.
also have a DJ. It's quite the DC scene.
I
So
like it.
recommend that. I think, you're like me that we need like the music, the
Yes,
good food,
music,
and
movimiento,
movie.
música. Like I love it. I love it. Yeah,
So
I
that
love
I
it. And you know what I went to. Although I don't think it's a restaurant. It's called Barcelona.
oh yes, yes, Barcelona.
I stumbled upon it. I was meeting with we oftentimes, because we have headquarters in California, they come and they meet me, and I'm obviously from California, so then I'm like the hostess with the mostest. And we stumbled upon it. We went somewhere and I was like, oh, there's like this bar. Let's go over here. And I was like, oh, wow. I was like, I like this. I like
I
this.
know they have great music on the weekends too.
Yeah, great music. And so, they have, when people ask me, like, do you like DC? I'm like, I don't know if I like DC, but DC loves me. Because I feel like, and I was gonna say, I feel like DC has a thirst for freedom and like, but yet you are in the nation's capital where there's just so much, politics, and there's just a lot in terms of the industry. And California is music. I mean, I'm sorry, music and movies, right? And so there's a lot of thirst and appetite for creative expression. And so what you find the difference between the West Coast and the East Coast is there's much more refinement on the East Coast, and there's much more freedom and creativity on the West Coast. And so when they collide, but we both want each other, right? The opposites attract. So when someone from New York or from DC comes and they're like direct, they're about it, da, 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 like people from LA are like, ooh, you're not from around here. We're not hugging trees. You're like so direct. I love it. Like we thirst for it because we yearn for it, because people are like, well, let's talk it out. Let's kumbaya. And there's a lot of like lack of clarity. It's not clear and crisp. But then conversely, if you come to the East Coast, you're free and you're dancing and you're just much more expressive, and you talk about your feelings and your emotions, being vulnerable. And they're like, whoa. But then they're like, I like you. You got a lot of energy. Like you're a vibe, and you're clearly not from here. You're not as refined, but you're free. So I always like to compare the two in terms of how they are. So, but both yearn for each other. So it's kind of cool.
I agree. I think that one of my favorite things in DC is how integrated like culture, arts, politics, like it all kind of
All
meshes in together.
yes,
And there is something for anyone.
there is.
There's like green spaces for people who want to go out with families. There's museums, art
Beautiful.
shows,
Yeah.
Kennedy Center. I mean, it has a little bit of everything. But I am so sad that we need to wrap up because
I
this
know.
conversation
Thank
has been
you.
amazing.
Thank
Cynthia,
you.
thank you so much for joining us in the Flamingo 60 and sharing the wealth of information that from a marketing standpoint.
Yeah.
And we can't wait to like go eat lunch because we
I
have lunch
know.
dates
You
coming
gotta
up.
show me around.
And yeah, and I'll be showing you around. So thank you so much for your time.